All right. Welcome. We are live right now, recording in the studio. Planetary Health first, Mars next, and it is awesome. I'm super excited. This is part of the Bring a Friend series. And this isn't just always just being friendly friends. When you're with friends, you can really get noodle and dive deep into things and disagree. And hopefully, we'll have a dynamic discussion. I know we will because we have Lisa Sherwin. And she is now moving forward with Sherwin Advisory Services, and she's going to be doing some super great things. She's sunsetting her days at Village, so she will be taking a Village with her with all her experience and all her great clients to come. Got Suzy Engwall with us, and she's also at Health Tech Strategies. So she's the CEO and founder. So it's super cool that we have both kind of independent advisors here that can really see the tea leaves, read the tea leaves. So we're going to be just doing some deep dive on Bring a Friend series on kind of from the provider space and also from the health tech space and some topics. We might just bring up a little change healthcare. So I'm going to just stop talking and let you guys start talking.
Sure. I'm happy to kick it off. 2024 is starting out to be a pretty interesting year in the provider space. You started out with some CMS rate cuts, although they're talking about, increasing payments for primary care, which is good. And then Change Healthcare hits. And, that's disrupted. I mean, they have over 50% of all the claims that get processed through them. Small providers are starting to get really worried about how much money they're going to have, how much funding. HHS is encouraging people to go and look for, other clearinghouses. So it'll be interesting to see how much market share Change actually has left after people start changing over to new clearinghouses in order to get their claims processed. And I think it's going to have a lot of downstream impacts with, again, HHS came out today and said you need to really double down on cybersecurity. It's not been an area that's always had a tremendous amount of investment in the provider space. It's one of those cost centers, and everyone's like, "Well, we'll deal with it if it happens." And now you have the biggest clearinghouse in the country that just got hit. So I think it's going to trickle down into Suzy and I both work with startups, and I think it's going to really trickle down to them. And what are providers going to start asking them about their security posture and what they're doing to make sure the data is safe and that they stay up and running. And it'll be really interesting. So it's
I think that's
already kind of a crazy year after 3 crazy years. Now we're starting out with this. We thought we were out of the woods, and I don't think we are.
I think that's a really good point, though, Lisa, what you're talking about with the startups too, because I've sat next to so many startups presenting to hospitals and health systems and providers, and they always ask, "Are you HIPAA compliant?" But they rarely, if ever, ask about cybersecurity. And it's going to be really interesting to see the change that is going to take place now. And, it should have happened even sooner than this. I've seen, we've had a lot of hospitals that have been attacked by these cyber criminals multiple times over the last few years. Yet we've still kind of seen this trend where hospitals are afraid to pull the trigger to spend the money on cybersecurity. And then what happens is they end up spending 10 times more on the back end after something bad happens, right? It's insurance, right? It's insurance for your hospital to a degree. And I don't like paying for my homeowner's insurance, but boy, am I glad it's there if I need it, right? So I think it's the same kind of thing, but it's going to be really interesting to see what happens with a lot of these startups. I think that's a fantastic point.
Yeah. Do we know if the providers are the providers getting paid yet? I mean, where are they? They're still not getting money yet.
No, they're still not getting money. They have claims that had been in process that had already gone through and been submitted, and there's always that lag. But because that lag happens, now anybody that they've seen, since February 28th, they haven't been able to submit a claim on. So, that's just going to start to really snowball for them. Or February 22nd, I guess it was. I'm a week behind. So,
And a lot of them still
Um,
haven't even recuperated from the pandemic yet. They're already
yeah.
short on money. So this is just adding on top of that pile.
And most of them don't have a lot of reserves at the end of the year to begin with. So, and a lot of people don't go to their provider at the beginning of the year. If they have high deductibles, they kind of wait till they're starting to hit their deductibles. So there's always this kind of lag and seasonality to the revenue anyway in a provider practice. Add to that, they can't do prior authorizations, eligibility checks, and you know, and this is really, really hitting them hard. And they're all starting to really think about, how do I make payroll? And I think United Healthcare came out and said, well, we'll give you 4,000. One provider is quoted as saying they offered me $4,000, but my payroll's 350,000. So
That'll help.
yeah, what's that going to do? So I think you'll start to see other downstream impacts for technology companies with a cash crunch. If they can't pay salaries, or they're trying to just maintain their reserves to be able to pay their staff so they can keep their doors open, see their patients, and actually have supplies for patient care. The new technology, signing up new vendors is going to be way down on their list.
And pharmacy's a disaster too. People aren't able, that's been really impacted as well at the point of care with pharmacy.
It has,
Yeah.
and I've seen some of the write-ups around veterans not being able to get their prescriptions because the military health, VA, those prescriptions are running through that same clearinghouse. So yeah, it's a little bit of a crazy few weeks here.
Yeah.
Well,
And I
Suzy,
don't
we
think
heard
it's
your
gonna
we
get-
heard your cat, Suzy. What do you think?
I know. I just kind of looked at her. Like, she's not
That's
happy
Hey,
about it.
we're getting real here, man. The cats, dogs, we're animal friendly on Planetary Health, gang.
She's very upset about the whole thing, right?
Oh yeah.
I think it's interesting because this incident, I think, is going to change the way things work for a long time. And we probably need that change. It's unfortunate that we had to have this happen to make that change. But, I think there's a lot of other things in healthcare that still need to be fixed. And I just read an article today about, Amazon's One Medical and how they're partnering with more and more health systems. And the first thing I saw when I saw the headline was like, thank goodness. Because I'll tell you what, I don't go to my PCP office anymore. It's inefficient. I go to One Medical. I can get in that day. This is going to sound like a commercial for One Medical. Amazon, you can pay me later. But it really is. It's so much better. I needed to get an appointment. I got in the same day. I send my provider a message. They say they'll take up to 40 hours to get back to you. I always get a reply within 2 to 3 hours. I get what I need from them. I've been waiting on a referral to a specialist for over a year from my PCP. It's never coming. I've given up. I've thrown my hands up in the air. I can either be sick or I can take another thing. And I think just like patients are learning how to adapt in this new world and finding resources that they can take and use, our providers in our hospitals need to do the same. And they need to start looking around and seeing what's going on in other industries, what's happening in our industry. How do we take these incidents like what's just happened with Change Healthcare and learn from it and make sure we're putting new technology in place so that we don't have this happen to us, but also not just around this issue, around so many other challenges that healthcare has right now.
Absolutely. I think there's definitely a lot of lessons that can be learned from looking at how we always think about Amazon and they keep trying to get into healthcare and now it seems like they really are. And they just think about it differently. And, I think taking that kind of retail approach to healthcare, like how do you reach out? How do you make it easy for the consumer and make sure that they're able to get in? I mean, I have some of the same issues up here in the Northeast with trying to get into a provider. I mean, you get on a wait list, and I think I got on a wait list 5 years ago for a PCP in my local area. I still haven't heard back.
And
I drive, and I know I never will. But they're owned by a health system. And that's kind of the only game in town. So I can drive 3 hours or I can do a telehealth visit with someone. And who has time to, drive back and forth and hour plus or 3 hours each
Well,
way.
and
And
then you got to sit in the waiting room for 2 hours. Don't forget that.
oh, yes, absolutely. And then you have to go somewhere else for your labs and somewhere else for, so yeah, taking a day out of your life when you can, kind of toggle over on your laptop and go to a telehealth visit and be done and go back to what you were doing, and then know that your prescription's coming in the mail, or now you can just schedule time, and the labs seem to be way more efficient. They get you in and out.
Yeah, and you're right. And I think that's just another cue that healthcare needs to learn. A lot of the people that are decision makers in purchasing, healthcare and deciding where they're going to go now are people that, my son's 21. He wants to start making decisions about his own health. And guess what he's going to do? He's going to go to anywhere that makes it easy for him. He grew up in the generation of having iPhones and technology readily available for him. He just asked me the other day to make him an appointment first to see a specialist. And I said, well, we got to wait to go to your PCP first, but then we got to do all this rigmarole. And in about 2 months, maybe you'll see someone. And that it's just not acceptable. They have grown up in this era where I can get everything I need right now. So why would I wait? Why would I accept the status quo? Well, maybe some of us are slightly older. I think I'm only 22 or 23. We're willing to put up with it because it's just the way it's always been, right? But the younger generations are not going to accept the way things are. So we have to make change. We've got to embrace technology, and we also have to prevent technology from killing us at the same time. Like what happened with Change Healthcare. We've got to make sure that we're protected, but that we also can help make healthcare easy for everyone and accessible.
So have we brought up any conversation about VC funding? Where are we at with that? Where are you seeing the two of you?
You want me to take that one, Lisa? I can start if you want.
Yeah, definitely start with that one.
Yeah. So, I work with a lot of startups in the healthcare space, mostly MedTech on the MedTech side. VC funding, we all know, has been really, really difficult over the last couple of years. And some of it was a market that really needed to be adjusted. We had inflated valuations. There was a lot of crazy stuff that was happening in the market. I saw too many companies raise millions and millions and millions of dollars and then 12 months later disappear. So we needed to be a little bit better about things, but we may have overcorrected a little too much, right? So on the VC side, the good news is what I'm hearing in the market, and I'm not a venture capitalist, but what I'm hearing in the market is, that VCs are starting to come back around a little bit, starting to loosen their wallets a little bit. But the interesting side of things too is that a lot of people are turning to family offices, and family offices have always been an option, but they've been really very hidden and kind of stayed in the shadows a little bit. So you had to know somebody who knew somebody, or you had to know who this family office is. And they're starting to kind of come out of the woodwork a little bit more. And they're starting to raise their hand a little bit more and say, hey, I want to invest in this. And, I think that might be a partial answer here. I also see crowdfunding starting to take kind of a new resurgence in healthcare a little bit. And that's an interesting play as well. So I think there's some alternative funding sources that are coming out of there. Of course, angel investing, I feel like it's going to be around, right? But it's going to be interesting to see what happens on the VC side. Another kind of new trend I've seen over the last couple of years is you've got all of these like venture studios popping up, right? They're all over the place. And those are great because they're kind of bringing together the entrepreneur and the funding at a very early stage. With a lot of them, though, I kind of feel like they're missing one critical piece. They're missing the provider and the health system side of things. If we could do this venture studio model and bring the health systems in from an early stage to where I'm making a great product that's venture backed or that's backed by some sort of funding that also already has a built-in pilot at the ready because I'm building something this hospital wants and needs. How much faster can we accelerate the time to market for a lot of these early stage startups?
Oh, yeah, absolutely. If you can get provider feedback into your product early and often, you're going to get a better product at the end. You're going to be way more successful. You're going to be able to pivot early versus getting down the path, talking to a few, maybe having a little pilot, but not really having that early feedback into that MVP to really help guide that and help be a voice and saying, hey, this technology's really helped us, and
Yeah.
having a group of clinicians and, other people within the provider space who have had input into it.
Yeah, I
So
think
I think that's a really interesting, way to put a studio together versus just the VCs and the startups.
it needs to happen. And I'll tell you, working with some of these accelerators, and I help run a pre-seed accelerator out of San Francisco. And a lot of these companies, one of the biggest issues they have is, how do I get in front of my customer? And that could be the provider, it could be the patient. A lot of times the provider is the one purchasing and the patient's the one using it. But you've got to be able to get in front of these groups. And if you didn't grow up in healthcare, you may not have those contacts. And a lot of them don't. We see a lot of people who are great founders that maybe they grew up in a whole different area. Maybe it's tech, maybe it's something else. They had something bad happen in their life with a family member, and they're like, I'm going to make a change to this, and they start a company. And then they need to come in and they need to get that early user and provider feedback, and they don't have the access, they don't have the resources. And so how do we bring that to them so that they can also accelerate it? And I, if it's not surrounding you every day, sometimes you forget, and then it's silly. People know they need to go back to the well all the time to get that feedback, but a lot of times they just don't. And so they get early feedback in the beginning from the few handful of people that are willing to talk to them or that they can tap into one way or another. And then they never get feedback again. And then they get 2 years down the road and a few $1 million later and can't understand why nobody wants their product or why it's not good product market fit. It's essential for product market fit to speak to your customers. And it's, startup 101, right? But yet they're boxed out of that. They're not able to do it. So if we're going to look at this venture studio model long term, I think that we really need to start filling it in with a lot of these health systems.
Well, it also helps from the technology perspective to see how your product plays in that ecosystem, because, and we've seen some startups come in or some people come in with ideas. I want to do this. And it's like, well, a lot of these health systems already have Epic and they do that. And whether or not people use it or whether they do it super well in that particular segment, the health system isn't going to agree to pay for something that they're already getting with a product that covers all their hospitals. So understanding how it plays, understanding how you actually integrate. And you were talking about One Medical and Amazon, being able to make sure that your data is there and that it's not just there, but with any other providers that you have. Every health tech startup, if you're collecting that patient data, you've got to be able to communicate it back to the other systems, or you become a small silo, and that becomes an issue. And you can end up with the clinicians and the technology team saying, hey, like, cool product, but we can't get it to talk to anything else. So knowing how it plays, how it fits in, I think also helps just with that whole sales story. Like, it works, clinicians like it, and here's how it fits in to everything else that you have in your ecosystem.
You're absolutely right. Absolutely right. And, provider workflow is one part of that fit too, right? If it doesn't fit into the provider workflow, they might buy it, but it's not going to get adopted, and then they're not going to continue to use it. So you better make sure that it fits in the right way.
I've seen so many providers just drop a really good product because I have to switch windows. I don't have time to switch windows. Or even their MA who's rooming the patient. If they have to go 3 different places to figure out who's coming in, where are they at, what do I need to do? It's not going to happen. There's not that much time in a provider practice these days.
Yeah, every second counts. And when you've got a mandate that I got to get through seeing my patient in 20 minutes, every second counts, especially when they come in and they say, well, I also have these other 5 things wrong with me. And we all know that when we say that, they say, you're going to have to make another appointment. I can only see you for your chief complaint right now.
Yeah.
So what are you seeing kind of the different mentality with the VCs versus, when cash, you could get any money from anything where the interest rates were so zero, like now, what are you hearing with kind of, what are those requirements out there?
I don't think that the requirements have necessarily changed. I think they're scrutinizing much closer the founder and your product market fit, especially at an early stage. Later stage, traction, and what results are you getting? What does the ROI look like from the customers that you do have? But when we're talking early stage, which is typically who I work with, I usually work with early to mid. Early stage, it's really about the team. Do you have the team that's going to pull this off? And we're going to check. You can't just tell me, hey, I work with Dr. So-and-so and slap it on your slide deck and think that we're not going to check, right? And then, do you have the team? Do you have the knowledge or people on your team that have the knowledge? And do you have the right product market fit? And demonstrate to me that you have the right product market fit. I see these folks with these beautiful, great slide decks, and some of them can be enormously long, which should not be the case, by the way. If you're building a slide deck, it should be 10 slides with all of this junked up information in it. But you really need to be clear and concise, and they need to understand, how is this going to play? Who's going to buy it? Why are they going to buy it? And really all comes down to product market fit. And you cannot get good product market fit unless you're talking to your customers. And that kind of goes back to the point we were making earlier. I think that VCs are just scrutinizing this a lot more than they used to. And not to say that they weren't doing their due diligence, because I'm not saying that at all. But I think they were maybe passing things along that maybe they're looking at a little bit harder at now, if that makes sense.
And with the studio, I love the startup studio analogy. Do you find like VCs are getting better at partnering with health plans, partnering with health systems in order to de-risk that as part of that product market fit? I mean, is that what the startup studio is?
Well, it should be if it's not. I do see that VCs are partnering more and more with health systems partners, providers, that kind of thing. They're even using providers as scouts and things like that. But the venture studio models that I've seen, that doesn't mean they don't exist, but the few that I've seen over the past few years are all entrepreneur investors joining forces from an early stage. It's not entrepreneurs, investors, and the hospitals and healthcare systems. So I truly feel like that's a missing piece, and maybe there is one out there doing it. So if that's you, I apologize. Glad to know you're there. But if you're not there, then add that piece.
Absolutely.
And Lisa, from the provider side, what would you tell an entrepreneur that really wants to make something great in healthcare? Like, you have so much knowledge from the technology and the provider and the value base, which is still, I mean, I think it's got legs there. What would you say?
Yeah, I would say absolutely find, and I'm very much provider focused. Find providers that you can partner with. Find people who know healthcare, even if they're not a co-founder. Get a board of advisors and get a group of people who understand what that provider market looks like, have connections, even if it's not a sales presentation, but being able to sit down and talk to, if doctors are one of your target audiences, sit down with groups of doctors and talk to them about what it is that you want to do, get their feedback, find out, if this is something they'd be comfortable with. If a patient needs to use it, would they be comfortable asking their patient to use it? Because if they don't say yes to that, even if it's a beautiful product and it's serving a need, if they're not comfortable saying, I'm going to hand this over to my patient, then it's not going to go anywhere. So finding that kind of group to be able to talk to get in front of, and if you don't have it, if you don't have a network, get a group of advisors that can help make those connections for you, because that's a really critical component. And that really helps. Suzy was talking about product market fit. They're going to tell you the good, the bad, and the ugly. I don't know many providers who pull punches.
Yeah.
If you're telling them this is something they may have to use, or one of their colleagues may have to use, they're going to tell you how it is. And it may not always be something you want to hear, but it's something you need to hear.
Well, and I think
Lisa or Susie, do you know, is there a group where they kind of try to do that at MVP where they get doctors' feedback as quick as possible? Is there doctors that are really involved in that? Like, how do you approach physicians? It seems like that's a hard group. They're very busy. What would you guys recommend?
well, there are a few resources out there that you can tap into physicians who want to be in this innovation space. There's a company that I've worked with before called Clinician Exchange, and they have thousands of doctors who are available for set periods of time to help you with different things. I think you really have to kind of just get out there and really work the system. So who can I call? Who can I talk to? Accelerators are good for that. I think that's one of the benefits of working with an accelerators. They are usually involved with different physicians and things like that. There are places that you can get them. I think there's a couple of other portals out there. I think that you can buy a doctor's time for like an hour, that kind of thing. Patients you need to get to too. Mm-hmm. So if you can get to the doctor, sometimes you can get to the patients. They're harder to get to, but there are ways around it. I think the interesting thing, if you're a startup, I was on a phone call with one of the startups I work with today, and talking to a really well-respected physician down in Texas. And at the end of the call, he said, "Hey, do you guys need an advisor? I'd love to be an advisor on this." Mm-hmm. For me, there's no bigger compliment than you can get than a really great physician seeing your product and saying, "I want to be an advisor on this," because they have limited time. They have, that's a precious thing for them. And if they believe in your product, that's really a good signal to that you're close to or have product market fit. If you've talked to 1 million clinicians or 1 million physicians and none of them want to be your advisor, you may want to rethink what you're doing. Mm-hmm. If that helps.
I like that. So it's sort of resonating with what Lisa said with the advisors, really reaching out, building that network. So where do we want to go now? We've covered a few. We've started with Change Healthcare, low-hanging fruit. And we're kind of at that point. We're at about the half point here. I'm so glad you're here. You guys are friends. This is part of the Bring a Friend series. So where would you like to go today on this show?
What do you think, Lisa?
Oh, gosh. I don't know. There's a lot of places you can go.
You want to open the AI can of worms or leave that for the next sucker? We can talk artificial intelligence if you want. There's a few things that I think we could really talk about in that space. I don't know.
I love your post. Create something that can translate for your dog.
Yeah. Well, when I was CES this year, I actually saw an app that supposedly, allegedly, I haven't seen it work in real time, so I can't say whether it's a good or bad app. I have no idea. That will translate your baby's cry to tell you if they're hungry or they're wet or they're whatever. And then I was walking past a newsstand, and they had this dog thing, and it was like, learn how to translate what your dog is saying. And I'm like, oh, we need an AI app for that. So that's when I wrote that post. And I was kind of half joking because, you have a dog for a little bit, you kind of learn what it means. And I think it's the same thing with babies, but I'd love to see if somebody can make an app that really does translate that. I think we're going to have apps for everything here pretty soon. It's happening so fast. Whereas probably 2 years ago, I saw a few companies here and there that were using AI for different things. A lot of AI in radiology, in imaging. That's one of the probably lower hanging fruit things to tackle because there's so much data and there's so many images that you can take and learn from for these algorithms. And data, historically in health and in the EMR systems is kind of a mess, especially from hospital to hospital. So taking that data and really making it usable by some of these algorithms can be a challenge for sure. But people are getting better at it. And I really think that there is a lot of opportunity in healthcare to make some really great changes. I also think there's a lot of opportunity for it to be really scary for us all at the same time.
Mm-hmm. Yeah. I did see that post. I did see that post with the dog, and I said, if it was translated, that the dog would say, "You guys, I'm the master of the universe," or something like, "I got you fooled," or something. I forget what I said, something like that. I love it.
You're absolutely right. I would love it if it says things like, "Get away from me, lady! You're smothering me." Like, I don't think my dog would say that. She's smothering the time.
You guys
But,
are so stupid. You feed me all the time. I got you wrapped around my finger and you think you're smarter than me. All right.
yeah, I love it. I love it. Well, maybe someone will build it for me. Who knows?
You never know.
But I mean, it's
But-
an interest. Oh, go ahead. Go ahead, Lisa.
Yeah, I was just going to say, what you were saying about, healthcare and AI, I think there can be tremendous ROI in it for healthcare organizations. But, again, not to keep banging on change, but I mean, that's just shown having the security around that data. I mean, you're feeding huge amounts of data into it and making sure it's secure. I know that's a lot of provider organizations, we're using it more than what we think we are these days.
Yes. Yes.
Um,
Absolutely.
there's definitely lots of different applications to help make people more efficient, help with diagnosis. I've seen, some studies and some write-ups where early diagnosis for diabetes, for different types of cancer, all of these things can be accomplished with AI. And I think that's fantastic. I mean, that's a huge boon for the industry. If we can, reduce the workload on providers and the amount of documentation, and there's a lot of the ambient listening now that's out there to be able to help them with that documentation. But, it is that fine line of making sure it's still secure and you're not just using every open source AI app out there, but really, where the data's at, how it's being used, how it's being leveraged and how it's being stored. So
And
I think that's going to be
data.
right. And then there's always that health equity piece, because so many clinical trials, so many studies, so much of our healthcare data still has some bias that's inherently built in, and being aware of that, and how do we make sure that we don't continue to increase or make those biases worse and impact health equity in a negative way. I think it can do the opposite, but we just have to be really aware of how we're training it, what it's looking at, and that we're taking those things into account.
Yeah, it makes sense to me too. It's interesting. It's going to be, I think, revolutionary in a lot of ways. I also think, you have some physicians that aren't very aware of AI or its capabilities. And just like the rest of the world, I think it can be a little bit frightening. Is it coming for my job? Is it going to, what if the algorithm's wrong and it harms my patient? I think it's going to take some time for people to trust it in healthcare as well. And so it's something that we really have to watch for. But I think you're always, at least for right now, I can't say what the future holds, but at least for right now, you're always going to need that human behind it, double checking it, right? So if my AI for radiology app tells me this person has breast cancer, it's right here. I'm not just going to go tell them, hey, you have breast cancer. I need somebody to actually look at it and say, yes, that's confirmed, that AI was right, right? So I think for now, we're going to see a lot of them be clinical decision support tools instead of being diagnoses, even if they're capable of diagnose, because it's a little bit easier to get through FDA when you call it a clinical decision support tool. But the requirement really needs to be that a human set of eyes is on it as well. And I think radiology is a good, kind of a good place to look at, because if you're the radiologist, or if you are the one that has to look at all those images, you could have 3,000, 4,000 images from one session. How can you possibly look and see all of those in like the 20 minutes or so that you have to look at all of these, right? So I think it can be really, really helpful as we move forward. And I think people shouldn't worry about it taking the job of the physician or the clinician just yet. Can't promise that that's forever. But I think, right now it's going to be a really exciting time of seeing how it can help solve a lot of these problems, create more efficiencies, help maybe even keep staff in place who maybe were otherwise going to leave because they're so overburdened with nonsense that maybe AI can pick up and do. But it's going to be interesting for sure.
Yeah, from a clinical efficiency perspective, I would not That's the last place I'd worry about it taking a job.
Yeah.
Because we can't fill a lot of the jobs that are out there with
Yeah.
all of the shortages in clinical staff. So if we can make people more efficient, reduce the burnout, and if an organization using it can make it a better place, then they're going to have better staff retention. I mean,
Yeah.
just building in efficiencies.
I think making it better for the patient too. There's an AI company that I'm working with right now that is addressing the age-old issue of alarm fatigue. It has been a problem for decades, and it's a problem for everybody, right? And I got to know this very well. My brother was hospitalized for months. He had a bad surgery gone wrong. He ended up being hospitalized for months. And I'd be up there, and I work in healthcare. I know what happens, right? His alarm would be going on, the alarms would be going off, the IV pump or whatever, and the nurse would come in and hit a couple buttons and walk away, like multiple times an hour, right? And every time it's like this panic, like, is something really wrong and you're not telling me? Like, what's happening? So there's this panic. There's also this ability for patients to not get the rest and the sleep that they need that causes a lot of delirium. It prolongs healing, their ability to heal. They're sicker longer. And then for the nurses, it's just chaos, right? So this particular organization is using transparent AI to help silence those nuisance alarms. Mm-hmm. And I really think that that's a really good example of where it could be used and could be used safely. It can, dialed in within those, standards of care. So I think we're going to see some cool stuff, but I don't know. It's going to be interesting.
The other place it can make a patient's life better is just in the external interaction with the healthcare system. Knowing if I can log in to my app on my phone and ask to be scheduled for a visit, and it can look and see she always comes in on, before noon. She comes in between Tuesday and Thursday, or usually looks for a Monday or a Friday, and can weed through the appointments and say, this is the next available appointment that matches your profile. And then say, here are some others that are available if you need to be in earlier. But being able to look and, bring up kind of the right schedule for me. Here's with my provider. I don't have to go pick the provider and pick the type of, So the never ending selection boxes. And then I may or may not actually find an appointment slot. Finding the right referring providers. Or the right, provider to refer you to. Finding somebody who's in your area, finding someone who's, close to where you work, close to where you live, like, where do you get your care? And, being able to look at quality measures, who's really the right specialist, who's, board certified in this area, and help to narrow those things down without staff having to do it and figure it out and sending you some list or printing a list out on the printer and handing it to you and say, here's people you can call. Or having to go and do searches on your own and go, all right, well, they sound good.
So Lisa, I feel like you described like AI in a perfect world if done perfectly. It's just beautiful like that.
Yeah.
It's like all the things that are just so drudgery, it's like just making it make sense. And I hope we see maybe many of the applications like that. But there is that other side that, if they don't have the application done right in the sandbox, I mean, it's just the wild, crazy generative AI, I guess, the what it just comes out and does. So anyway, but
I've interacted with some of the chat bots that I know are generative AI, and I'm like, just find a human.
Yeah.
Oh my gosh, the chatbots are the absolute worst. I have yet to see one that's done well. And if you're doing one and you're doing it well, more power to you. Send me your name. I have yet to see one that's done really, really well. And most of my animosity toward those come from working with the cable company and the cell phone company.
The cable company didn't get it right in their phone trees, and they're not getting it right in their chatbots. So.
Yeah.
Get me a real person.
Like yelling at my keyboard. Like, I don't want any of these choices. Can you give me the choice I actually want?
Yeah, it is frustrating. I've seen some really bad, that was just not done well with some of the chat AI stuff. That just like, how is this going to help the end user or the patient or a care navigator? This seems like more work. I think stuff like that is usually really has a big opportunity, but it just like the ones that I've seen just are still crap. Like still like the cable chatbot. I don't know if you guys have seen anything exciting, like applications that are promising.
I think some of the AI that is so I know there are several companies using AI in ambient listening for physician notes, so their documentation, which is definitely a step above, the old dictating to a phone tank and then, trying to type in and have it correct, or going to a microphone and having to have the right microphone. So I think that's a step forward, and I think there are some companies that are doing that well. Suzy mentioned some of the AI with radiology, so I think there's some pieces like that that are going well. I think it's when companies are saying, well, I'm going to try and reduce the number of people that I have taking a phone call. And I'm going to call it AI, and I'm going to put this in, and then I can say I put AI in my contact center. So if slapping it together, kind of throwing it out there to say you have it and as a reason to reduce staff, it kind of hits all the wrong marks.
Yeah.
But when you start to look at it and say, how do we do it right? How do we try to increase efficiency? We're not trying to get rid of people, trying to make it more efficient. How do we, you know, try and get to a better diagnosis or a faster diagnosis, or do some of this earlier in the process? And you still have a person who's looking at it, but you're helping to just make sure they're looking at the right thing or help them focus in the right area. So they don't have to look at all 3,000. It's like, okay, here's the ones that have the highest likelihood of showing me what I need to see. So I think there are some companies who are doing that really well, but those are all very thought out, lots and lots of data. There's lots of money and time that's gone into it. And it hasn't been because it touches a clinician or touches a patient and touches their lives. It's not one of those things that people have thrown in. So I think when done thoughtfully and with a clear purpose, ROI, whether that ROI is in health outcomes, whether it's in efficiency, then you'll see things that are done really well. It's we tend to interact daily with the things that are just kind of thrown out there to try and say we have AI and we're being more efficient.
I think that's a really good point. There's so many folks that kind of just throw AI out there because they want it to be sexy or they want to be up on current trends when maybe their product's even better without it. And I remember, a couple of years ago, meeting with a company with a group of other people who actually have AI in their name. And we talked to them for an hour and they left and we all looked at each other and I'm like, where's the AI in this company name AI? I couldn't find it anywhere. I'm like, what are they using AI for? I don't understand what they're doing. So I think you do have to be thoughtful about that. And, I love the subject of human-centered design. I talk a lot about it. It has a lot to do with product market fit. And I think it all comes back to that. Like if you want to use AI, make sure you're using it well, make sure you have good product market fit. I guarantee you, if the cable company used the principles of human-centered design when they designed their chatbots, they would have a much better product. All they would have to do is come over and watch me try to use it one time and see. They don't even have to talk to me. They can see the frustration on my face as it's reddening and getting mad because I don't have this much time to waste, right? And I think that it all comes back to that. Regardless of whether it's AI or something else, the problem I think that we have a lot of times is that founders experience a problem and then they set out to fix it, but they're fixing it through their own personal experience only. And when they're not taking into the account the experience that other people have had. And so when you're using AI, you've got to do that as well. It all boils down to that simple concept. What does my customer want and need what problem must this solve? And if AI is the best tool to solve it, by all means use it. But if AI is not the best tool to solve it, if I can solve it with a piece of tape, then I'm going to use the piece of tape. And it makes no sense to throw AI at it, right? So it's really what's the best, the easiest, most cost-effective, most streamlined way to give people what they want. That's what it boils down to. It's simple as that.
Absolutely.
And if it's duct tape, just charge them a lot, right?
Well, if you're a hospital,
I'm just kidding.
You got to charge at least $300 a foot, right?
Yeah, yeah. Well, this has been awesome. Kind of coming down. We're going to land the plane, whatever you want to call it. This has been great having you, Lisa and Suzy, on today. Anything else we want to, kind of leave our audience with? You guys, we've covered a lot of ground.
Suzy and I usually do in our conversations. There's definitely a lot of ground to cover. I think I would just leave it with, I know I buckle up for 2024. It'll be interesting between how it started, just in talking about AI and, there's more that's, coming down the pike there. It'll be interesting to see how it continues to shape up. Healthcare, I have to say, as slow as sometimes we change, it never really seems to be dull.
Yeah, there's never a dull moment. That's for sure.
I like that. What'd you say, Suzy?
I said, but we love it. Where you're
Yeah.
like, there's something wrong.
Yeah.
Just bring a friend,
I've
right?
stayed in it for 25 years. Someone asked if, are you going to do something other than healthcare? I'm like, I've spent 25 years, working in healthcare and, trying to help facilitate the changes in healthcare, and I'm with it to the end.
Yep, not giving up now. We're already paid our dues, right? We got to keep this going.
You're
That's
just
right.
getting started.
Yes, absolutely.
Well, this has been awesome. So glad that Lisa and Suzy could join us tonight on Planetary Health First, Mars Next, the Bring a Friend series. And we've covered a lot of ground. Until next time, we're going to have another one. But thank you, friends, for the journey. It's been a great